All right, we will get started. So good afternoon and thank you so much for joining us for this webinar on aged care advocacy and recognising abuse. Firstly, I would like to acknowledge the traditional owners of the land that we are all on today and pay my respects to elders past, present and emerging, and also acknowledge the people of the Ngunnawal people whose land I am on here today in Canberra. So today we have a really wonderful webinar which will be focused on discussing aged care advocacy and how we can recognise abuse. And we have two guest speakers. So our first guest speaker is Craig. Our first guest speaker is Jeff. Jeff Rowe, who is the CEO of Aged and Disability Advocacy Australia. Unfortunately, Craig, who is the CEO of the Older Persons Advocacy Network, has had to pull out last minute from the webinar, but it is wonderful that Jeff is able to step in and provide us with his background and experience on this topic. So Jeff is an OPAN network member in Queensland. His career in human services spans more than 30 years, with half of his career in senior and executive positions in the Queensland government and the non-for-profit sector. Jeff is an Older Persons Advocacy Network representative on the National Aged Care Alliance and a member of the Notifications and Immediate Action Committees of the Medical Board of Australia. So thank you, Jeff. We also have Kate Kennedy. Kate is a social worker at the Seniors' Rights Service. She is an OPAN network member in New South Wales and delivers direct social work practice and interventions that assist older people who are experiencing or at risk of elder abuse. So it will be wonderful as we hear from Kate today, some direct experiences, and we'll have a bit of an interactive discussion at the end of the webinar today. So I'll pass it over to you, Jeff. Thank you so much for stepping in, and it's really looking forward to hear your presentation and all you have to say today.
Look, thanks, Samantha. I really appreciate the opportunity to connect and share with yourself and all members who are online here today. Saying it was the last minute, it was probably the last 30 minutes, but there was a possibility that Craig may have been waylaid today, and the inevitable has happened. So bear with me, but I think I certainly should be able to give you a good understanding of aged care advocacy, and we'll leave the recognising abuse to Kate, who will capably walk you through that. During the course of today's webinar, we're going to ask you to consider some of the topics or issues that we're talking about today, and invite you to share your answers with us. And we'd be grateful if you could put your answers in the chat box. And also at the end of the session today, we're going to have a Q&A session. So if there are questions that emerge as we go through the webinar, please put them in the chat box and we'll endeavour to answer as many as we can. I too would like to acknowledge and pay my respects to the traditional owners of the land that we meet with today. For me, it's the Yagara and Turrbal people in Brisbane, but also I would invite you to acknowledge the many First Nations people that you are meeting on the lands of today as we go through. Telling you a little bit about OPAN, I thought we would start with a video. So I might hand over to Sumit.
For-profit organisations, giving a voice to older people at every stage of their aged care journey. Nationally, these organisations come together as members of OPAN, the Older Persons Advocacy Network. Whether you or a person you care for is seeking aged care services or is receiving aged care services at home or living in residential aged care, our network of advocates are here to help you. Understand your rights. resolve any issues you may be having with your provider, help you express your needs and concerns, and we can help you access services you are entitled to. Plus, our support is free and confidential, and we're independent from both government and aged care providers, meaning we're on your side. Nationally, we also raise awareness of aged care issues, taking your voice all the way to government. To reach out for professional, free, aged care advocacy support in your local state or territory, call OPAN, the Older Persons Advocacy Network, on 1800 700 600, or for more information, visit opan.com.au.
So as the video explains, we're a national network. We were formed in 2017, but the members that came together to form OPAN were previously service providers in each of the states and territories across Australia. So collectively, most of us have been providing independent advocacy services, education and information to older people in metropolitan, rural, regional and remote Australia for almost 30 years. And you'll see in the video that we've described ourselves as an independent organisation funded by the federal government. And we're independent of government and we're independent as service providers. And that's something that OPAN really prides itself on, the fact that they are independent and that they support older people and their representatives to address the issues related to Commonwealth-funded aged care services. And as the video noted, we also provide a national voice for aged care advocacy and promote excellence and national consistency in the delivery of advocacy services. So when the Commonwealth reviewed advocacy services in 2017, it wanted the service to be consistent, whether it was someone in Kalgoorlie, someone in Coolangatta or someone in Katoomba. They would all receive that same access to services and that same messaging from OPAN. So very much we talk about giving the older person a voice, amplifying their voice. And that voice is on individual issues that are raised with service providers, as well as the systemic issues that we see as advocates and we hear from older people. We raise those issues with government and certainly with the recent Aged Care Royal Commission. We also raise the concerns that we've been hearing from older people with the Royal Commission, and some of that's reflected in both the findings and the recommendation from the Royal Commission. So moving to the next slide, some quick facts about older people, which is probably things that you know, but it's good to see that they're up and in front of you. So OPAN operates a free helpline that provides advocacy, information and education 7 days a week. And when someone calls our 1800 number, the 1800 700 600, they're connected to a member organisation in the state or territory from where they are calling from. I think that's one of the fabulous things about this 1800 number. You will get, or that person ringing that number will get that local knowledge in the state or territory. So OPAN is a rights-based organisation, and that means that we support older people to understand and exercise their rights and to have their voice heard on issues that are important to them. When we talk about advocates standing beside the older person, we really are keen to make sure that the older person, the issues that are raised by the older person are raised by that person, and that the experience in supporting an older person with advocacy and with raising a complaint with their service provider results in them being more confident to raise issues in the future and to better understand the complaints process. We listen to older persons' concerns. We help them find an outcome that is satisfactory for them. The old saying, you don't always get what you want, but you need to ask for the things that are important to you, and particularly where they are within the scope of the aged care system, where they are things that they should be providing. So older people, their family members or carers can seek advocacy by contacting OPAN or reaching out to a network member organisation in the state and territory. You will find all of the details on the OPAN website, which will come up at the end of the presentation. Noting that while we work with family members and their carers, it's the older person who is our primary client, and we are informed by what they want. And I guess that's really important to understand, given that there are often conflicts between what a family member may think is the best thing for the older person and what the older person wants themselves. So a question I'm wanting you to have a think about is what advocacy means to you. How would you define it? How do you think it could support older people that you work with? So if you can have a think about those questions about what advocacy means to you, how would you define it, and how do you think it could support the older people that you work with? I'd like you to put some of your answers in the chat box, and we'll look at some of those in a moment. I wanted to briefly cover the Charter of Aged Care Rights, and while human rights don't appear within the Commonwealth's Aged Care Act, the Charter of Aged Care Rights is something that has been developed with input from a range of stakeholders. And it's a really unique set of rights under the Australian Aged Care Rights that outlines what an older person can expect when they are receiving aged care services, whether they are in a residential environment like a nursing home, or whether it is getting services in their own home. And those rights include a right to be safe and to receive high quality care, a right to be treated with dignity and respect, and to have their identity, culture and diversity valued and supported. It's really important to note that the Charter is available in 18 different languages, and there's a link there on the OPAN website. It's also on the Department of Health website, as well as some explainer videos are there as well. So migrants or culturally and linguistically diverse people have a right to receive culturally appropriate care, to eat the type of food they want to eat, and to engage the activities that they want to engage with. They're incredibly important for you as workers in the industry to understand that the cultural needs of aged care residents is recognised within the Charter, and people should expect to have culturally appropriate care and should expect that the issues that they raise regarding their care that have a cultural bent to them, they should expect those queries, those concerns, those expectations to be achieved. So summarising OPAN, in summary, a large part of our work involves advocating for older people and their families. Our advocates support older people to advocate for themselves in a range of ways. And as I said, ideally we hope that the experience of working with an advocate will lead to an older person being less fearful to raise a concern in the future, be more confident about who to raise a concern with, and also to understand that there is not retribution. It looks like we're moving to the next montage, a group of videos which is talking about a little bit older people's experience. I'd like to then come back and hear or cover some of the questions that you've raised or the answers you've raised in the chat. So we might flip to the video, thanks.
The first thing that is really important to me to have control of is where I live. I really want to choose where I am accommodated, especially in my latter years as I get older.
I like to be independent, physically, financially, emotionally, socially.
The first one, it's dignity. I'd like the staff to be sensitive to that, and I'd like them to respect who I am as a person and not someone who just needs to be toileted or showered.
The second most important thing is actually to be able to have control of what I eat, the food I eat, and my nutrition. because I believe that food is very important to retain my energy and my vitality and my brain function and the function of my body.
Mobility is very important.
Just because somebody can't speak or be articulate in what they say, it doesn't mean that they can't hear what you're saying. And there's a whole lot of things that flow out of that. The extreme, I guess, would be elder abuse.
And the third thing would be able to have control of just choices, you know, people allowing to make myself to make choices about my activities, my hobbies, and anything that I really enjoy, that I would have a choice. So as long as people consult me and ask me, I'm happy to be able to choose.
The utmost thing I like to have is culturally appropriate care, if I ever need it, which means culturally appropriate food, culturally appropriate activities, and have the choice to choose to live the way I like to live. I don't want to be shut up at 5 o'clock, everything in a, you know, the nurses comes now, it's time to have a shower. Now that's, to me, is invading my human rights and my privacy.
The cost, I think you can easily lose control of your finances when you go into care. It might make it very hard on your partner, and that would disturb me greatly to know that she is living a meagre lifestyle just so I can have care.
Okay, so there's some of the experiences of older people themselves. That's what they're saying are, you know, really important aspects of the care that they receive. I see that people have been perhaps a little bit shy in the chat box thus far, but just wanted to share a comment that was left. And it says, to me, advocacy means ensuring someone's voice is being heard and that they know what their rights are and supported to exercise them. And I think that's, you know, that's a really good summary of what advocacy is about. It's about giving an older person a voice within the aged care system. It's about ensuring their rights are protected within the aged care system and that their rights are actually translated into care, that people receive high quality care that is relevant to them as an individual. You know, choice and control are a couple of words that we often don't hear talked about within the aged care system. Advocates can support people to ensure that, you know, that they do have choice and that they do have control of the services that they receive. On a practical level, advocates are there to support older people to address their needs or their concerns. We also provide free education services to raise public awareness and understanding of older people's rights. And we encourage and empower communities where everyone is heard, valued and safe. We also deliver education, and our network organisations or service delivery organisations in each state and territory provide free, tailored education sessions to people who are accessing aged care or who are seeking to access aged care, to the broader community members, as well as health professionals working with older people and home care staff and carers. So I'd like us to actually, maybe before I go on to that, we certainly also develop a range of resources, and you'll see if you go to the OPAN website, a range of videos which are about raising public awareness about older people's rights and issues that impact on them. So, in recent times, we've done a range of videos about COVID, about the vaccine rollout, about rights, about elder abuse. There's a real range of resources, and I'd really encourage you to to have a look on the website to see, what information, whether it be the videos or whether it be information and fact sheets. There's some brilliant fact sheets there from Dr. Norman Swan, and I think we've missed his video somewhere in my slightly clumsy presentation to you this morning. And we might see if we can go back to that. But I just wanted to really ask a question for you to have a think about, and really consider, when you consider some of the clients that you work with, can you identify barriers they might be facing in accessing advocacy support? So while advocacy support is available, to date, OPAN's only been able to support about 1.5% of older people working in aged care. Accessing aged care, both across residential and community aged care. So if you can think about what you think some of those barriers might be, and again, leave your comments in the chat box and we'll look at them perhaps in a little while. So I'm going to ask Kate some questions now, and maybe I'm not, maybe I'm going to go back. My apologies. Well, no, I'll come to that. I wanted to go back to Kate, if I may. Kate, as you know from the introduction, is a social worker with the Seniors' Rights Service in New South Wales, and that's our service delivery organisation. So Kate, can you talk us through some of the scenarios when people might need an advocate?
Thanks, Jeff. Hi, everyone. It's so lovely to be here and to meet you over Zoom. We're all getting pretty good at it now. Can you hear me okay? I just, I work for Seniors' Rights Service, as Jeff has said, and I'm part of the advocacy team. I'm actually a social worker that works with people experiencing abuse, but I sit within the advocacy team, and we have a great team of advocates who work across New South Wales, a number of them in regional New South Wales. So people can find an advocate usually pretty close to where they live. So I suppose that's one really important point. Also, I think someone mentioned in the chat that, it's really about having a conversation around, what's going on for that older person and helping them to navigate that. I love that idea. It is about having those connections and conversations and allowing an older person to tell us what's going on for them or their family. Lots of situations where someone might need an advocate, but mainly, we know, and we work in the area, how complex, aged care and home care is. Just even that understanding about what is home care and what is aged care and how does the system work. So, understanding the different levels of care, how to get them, because some are quicker to get than others. All those questions can be answered by an advocate, and just really, having someone to actually, as Jeff said, be beside you to help you, to empower you to basically ask the questions you need asked and, complain about something or raise a concern. So it's pretty broad, but that's probably a bit of a snapshot.
Okay. So thanks, Kate. If we perhaps go back, looking at some of the barriers you identified, I was going to get something come through to me, but looking at it has arrived, technology. So the barriers identified from Haley has said many culturally and linguistically diverse families have a cultural obligation to care for their own elders. They may not feel comfortable seeking support to care for their own family members. And I think that's absolutely true. From Weng Chuk, mobility, language awareness are some of the challenges for older people. Certainly we, as advocates, I'm sure Kate, you can jump in here as well, but as advocates, we frequently have concerns raised with us by residents from a culturally and linguistically diverse background regarding the lack of acknowledgement of their individual needs and preferences. We see the aged care system at times trying to provide a one-size-fits-all response to the service that they deliver. And, we're all individuals. We all have different expectations. And, picking up sort of some of the comments here, it's incredibly important that we get a diverse aged care system that responds to the needs of the people that it supports. And putting it in context for you, about 1.3 million Australians access aged care each year in Australia. Often when we think about aged care, we think about residential aged care or nursing homes, but we know there's only about 230,000 people access residential care each year. So by far the biggest cohort are people who are being supported in their own homes or accessing aged care services within the community. So, I think that's really important when you're thinking about aged care, when you're thinking about, the culturally diverse populations, and as one of the issues raised here, families choose to support the older person themselves. There are services available that can complement families to support their family member in their home. And it's important that people know about where to access those. A couple of the other comments was having English as a second language, therefore supporting individuals to clarify their understanding to ensure that they are being heard. And we're seeing that with the vaccine rollout. And from Adam, a large barrier would be ease of communication, especially given many in aged care are hearing impaired or may not speak English. And indeed, a lot of people have a visual impairment as well. So people are often unaware how to begin their aged care journey when entering aged care. And I guess we also see that aged care happens at a time of crisis. No one ever seems to plan for aged care. I did hear a line at a conference a couple of years ago where it was explained that everyone wants to live a long life, but no one wants to get old. And I think, that denial that we have that we are going to age, that we will need aged care services, mean that we don't necessarily plan. So finding information on the care and services that you want and want to receive, and whether they can be your in-home or a residential aged care facility, can be confronting and challenging. Older people don't have to go through this alone. There are systems designed to help them navigate through that. Their family members or carers are also able to seek advocacy. So some of what OPAN does is about supporting people who are seeking to enter into aged care. The gate to access OPAN doesn't just happen at the time when people enter the aged care system. It's also about supporting people in that lead up. There's also been a navigator trial, or a systems navigator trial that's been rolled out in aged care, and we're about 18 months through that. And included in that navigator trial have been some specific culturally and linguistically diverse navigators. So there are some very specific services to see, what's the best model of support that we can provide people as they enter into aged care. As perhaps many of you know, aged care and support services and resources are available for culturally and linguistically diverse people and their carers. There are some providers who offer specific diets, activities, languages or spiritual needs to support older people, people's cultural and linguistic or spiritual backgrounds. For some of the people that you come across in your travels, they can use the translating and interpreting service to make contact with My Aged Care, with advocates, etc. And that's available on 131 450. And that service can also be used to talk to your aged care provider or the potential provider that you're seeking to engage. And services are also available through the COVID-19 pandemic. And as I mentioned earlier, there are a range of translated fact sheets, guides and information about the COVID vaccine on the OPAN website. So the multicultural OPAN Older Persons COVID-19 support line is being offered in 6 languages and gives callers from culturally and linguistically diverse backgrounds across Australia access to information in areas about COVID-19 updates and restrictions that might affect them, their families or their friends. That information is available on the types of residential and home care services. Also about access to aged care and community services that are culturally aligned and speak their language. And that certainly works more in metropolitan Australia than regional and remote Australia, is no doubt you know. Access also to aged care and community services that are, sorry, I've covered that one, and information on dementia support or caring for someone with dementia. The Centre for Cultural Diversity and Ageing also has some wonderful resources such as consumer feedback forms, multilingual health and aged care information and signage. So we'll be providing, I think, a fact sheet of all of the different links post the webinar. So if you haven't managed to get the information down, it certainly will be available. So going back to Kate, you're a social worker, Kate, who provides support to older people who have been abused. Can you tell us what is elder abuse and how widespread it is within the community?
Yeah, so abuse of older people or elder abuse, there's a number of definitions, I suppose, but the one that I am using, or that is an Australian current version, is that elder abuse is a single or repeated act or failure to act, including threats that result in harm or distress to an older person. These occur where there is an expectation of trust and or where there is a power imbalance between the party responsible and the older person. I think what's important to note is that it's characterised by abuse of trust, and and it's about that power imbalance. Like other types of abuse, it's about power and control. Older people often report to us that, I trusted my son or my adult daughter, and I never thought that they would do this to me. So I think it's those are sort of, I suppose, the characteristics of abuse of older people. In terms of how widespread it is, we don't have prevalence study available at the moment. I think it's a work in progress, but estimates are that it's between 2 and 14%, I think, but we know that that's actually an underestimate, even at the higher end, and that actually it is definitely underreported in our community. That's why it's so important that we are talking about it, that we keep talking about it, that we get loud about it, to paraphrase Grace Tame, because we really need to start to have more conversations with older people to create a place where people feel safe to be able to talk about what's going on for them. So that's what we hope to do through this awareness, and also, providing a place like our services where people can be safe to talk about what's going on and get some help.
Yeah, look, thanks, Kate. And it's often said that our response to elder abuse is where our response to domestic and family violence was 20 years ago. It's not something that people, and even people who are experiencing elder abuse, but, we as a community are not very good at talking about, not very good at talking about that. So it's incredibly important, as Kate said, for you to raise it. So we know, Kate, that elder abuse can take many forms. What type of abuse cases do you typically see in your work?
Yeah, look, as I said, at the Seniors' Rights Service, so we're the New South Wales arm of OPAN, or the part of the OPAN network. We have an advocacy service, as Jeff has mentioned, but we also have a legal service for older people. And so many older people contact our service initially for legal advice, usually in relation to financial abuse. But when we spend time with that client, and as I said, you know, creating a safe place where people can feel safe to disclose things, we find that somebody might be mentioning what's happening at home is actually pretty abusive. They might have an adult son in their home who is yelling at them every day and intimidating them, might be taking their money, or, you know, living without contributing. The older person might be talking about, you know, that they stay in their bedroom to keep themselves safe. So some of those sorts of scenarios, it might become their normal. So some of these scenarios or behaviours they might think are their normal. And I'd be really interested in hearing from you frontline workers around what's happening for some of the culturally and linguistically diverse community you work with around this, because I see a lot of older women, and many of them are from a culturally and linguistically diverse background, who might have a history of family violence, who are now being mistreated by adult children who are in a position of power in their lives. You know, they might have control over that older person's house, you know, their money, their day-to-day activities, who they can see. So it's that abuse of power, I suppose, and those family dynamics that can really, we see a lot of that transgenerational abuse, I suppose.
So talking about the abuse, and you've touched on sort of some of the signs to look out for, but, you know, what are some of the other, I guess, red flags or flashing lights or indicators that, you know, the people on the webinar should be on the lookout for?
Look, I think there are certain risks that obviously make someone more vulnerable. And I think just obviously getting older, you know, being, you know, having health issues, having mobility issues, maybe some, you know, hearing impairment, or, you know, all of those age-related components are maybe adding to someone's vulnerability. Being a woman, especially one who's experienced family violence, is certainly an increased risk. Being reliant on a family member who for their housing or for their care. But the red flags, I suppose, and that's where frontline workers like you all, you're often seeing some of those red flags first, because a lot of it's happening behind closed doors. And some of the signs can be quite subtle. You know, I think if you're identifying that somebody might be changing the way, you know, even body language, when a family member might walk in, you know, are they walking on eggshells around someone? Are there signs of, you know, them being neglected, that their, you know, their clothing might not be changed, or their care is not there? More kind of overt signs are, you know, that they don't have any control over their pension, for example, or their money. Or how they, you know, if they are free to maybe go and visit someone or have a family member visit them. Some of those are, you know, definite red flags that we see.
So based on your experience, Kate, are the risk factors for culturally and diverse people? And are those risk factors, you know, different from the mainstream population?
Yeah, it's interesting, isn't it? Because, I mean, all the signs and risks that we've just spoken about, I think, you know, they can happen to any older person. But an older person from a diverse background might have other factors that make them more vulnerable to help seeking and, you know, to actually even identifying what's going on, or maybe wanting to take steps or feeling able to take steps. So obviously, you know, language differences, and just that lack of access to information can be, as we've talked about, can really stop them from knowing what their rights are. And we rely on community organisations like the ones that you're all working for to maybe link someone into our services, for example. So I work quite closely with other agencies, community organisations, so that we can create a supported pathway for some of those people to actually, have a chat about what's going on and explore what they want to do. So as I mentioned, older women are particularly vulnerable to financial, psychological, and sometimes physical abuse. And many may feel stuck in their situation just due to those sort of cultural expectations around, and maybe community pressure around their role. Even when we're talking about adult children, there's still an expectation that, well, you're the mother, you're their mother, you've got to cop it, you've got to keep them living there, or so there's some of that interplay, I suppose, that makes it maybe more challenging for culturally diverse older people to get help. I'm interested in other people's thoughts around some of the visa holders that, we've had some experience with older people on a contributory parent visa who are abused by their sponsor family member. And these people are actually particularly vulnerable people, mainly because they don't have access to the sort of income support that, an Australian resident might have. And they are very reliant on that sponsor person that might actually be their perpetrator. They're often isolated due to language, but also due to the fact that they've left their country of origin. They're often, not linked into community support or connection here. And they might not understand that they have rights under Australian law. So, and where do they go for help? So, I suppose those are some of the particular issues for this cohort of people.
Okay, thanks, Kate. I wonder whether we just go back a slide, because there was a reference in there to some video resources, or maybe it's back another. So, I guess one of the things that we wanted to do was to really highlight that there are a range of videos that are available to explore. Do you want to talk about those, because they live at your place?
Yeah, so I really encourage you to go onto the Seniors' Rights Service website for these resources. They're called Money Matters videos, and they're in language, and they explore in really kind of, I suppose, from the community members or the older person's perspective, some scenarios about what's happening to them, which is abuse. And they're in language, as I say. They're really accessible. There's a lot of good information there about what might be happening and how to go about, taking steps. So I'd encourage you to go on there, and I think Samit's going to send you a link of how to find those. And there's lots of really great resources around. And I think, and in New South Wales, we have an Ageing and Disability Commission that has a lot of really great resources as well. And I know Samit's going to send through some of that information so that you can, be linked in, because a lot of it is about you getting informed so you can actually support and inform that older person you might be working with.
And there's also, apologies if I missed it, there's also the Elder Abuse Action Australia, EAAA, have got a great resource website with a whole range of, I guess the intention was that we've got a one-stop shop for information about elder abuse that's there and available to the public, which includes, people like yourselves. So, Kate, one of my final questions for you is, what can settlement service providers who are joining us today do to support an older person that they suspect or know is being abused? So your thoughts on that?
I actually think that we are so reliant on you as workers to, identify, so sort of, I suppose, to learn the signs of abuse and how to refer if needed. And it can feel a bit overwhelming, that sense of responsibility around how do I identify and, what's going on, because some of it is quite subtle, but there is lots of help here. And, you can contact OPAN, you can talk to someone like me in your state. But I'd really encourage you to get to know the signs of abuse and how, and what to do about it, really. You are the ears and eyes often, and you've built rapport with the older person. You know, you're often in a position where you actually, somebody might be feeling safe to disclose what's going on for them. So you're actually in a unique position, and we actually often do rely on you to maybe talk to us and say, look, you know, this is not lining up for me. I'm a bit worried about this person. What can I do? And we can certainly help you through that process. The key for us is to, you know, for you to find a safe place where you can have a conversation with that person. If you're not feeling able to do that, find someone in your organisation that might be able to do that, or link into us where we might be able to, you know, give you information to pass on to that older person. So yeah, there's lots of sort of, I suppose there's questions you can ask in that conversation. And again, it's about you feeling, you know, is that older person safe to you know, to answer those questions, or are they in a position to even, you know, know what those answers are. So it's really, it's a bit of a kind of evolving situation, but certainly we would encourage you to get informed and and know that we're here as a resource for you as well as the older person.
Thanks, Kate. Any final words from you regarding elder abuse?
No, look, I think it's just great to have the opportunity to build that awareness, and feel free to contact. I'll put my email in the chat, and feel free to contact me if you need any further information. I mean, you're going to get quite a bit, I think, but yeah, I'm here if you need to ask anything specific.
Yeah, look, thanks so much, Kate. And I'll just echo that. I think most of the OPAN service delivery organisations in each state and territory have elder abuse staff on the team. So, you know, there are people with that content knowledge, or people who can point you in the right direction for, you know, the elder abuse experts in your state and territory, and particularly, you know, in respect of the settlement service workers, those where, you know, there are, you know, the more culturally appropriate responses that you might be able to access locally. So there are some numbers up on screen. Again, just I suppose reiterating where you can go for assistance around elder abuse. There is a national elder abuse hotline, which, a bit like the OPAN hotline, diverts to the elder abuse agency in your state or territory. There is also 1-800-RESPECT, and, you know, I guess with some of the media recently around sexual assault, you know, older people, particularly older women, are often not seen as potentially victims of sexual assault. But we know from our experience that older women do experience sexual assault, and that there are services out there that are available to support. So please encourage people. So we're now going to, they're the you know, the OPAN contact details, and the OPAN website does have a list of the service delivery organisations and their contact details in your state and territory. So if you want to get to know Seniors' Rights Service better in New South Wales, or Elder Rights Advocacy in Victoria, or ADA Australia in Queensland, and I could keep going around the country and I won't, you'll find the contact details there. So I think now the plan is that we go to some of the questions that have been put up during the course of the meeting, or the webinar.
Yes, thank you so much, Jeff and Kate. That was fantastic, just hearing, you know, the experiences of you, Kate, and how, you know, some of the things for us to note with abuse of older people. We've got a couple of questions that have come through, so we might go through them. And Jeff and Kate, I'll probably just put the question out there, and whoever thinks it's more relevant, or both of you can answer it, however you want to approach it, we can go from there. So the first question is, does elder abuse look different across different cultures? So obviously keeping in mind that providers on this video conference deal with a whole range of different cultures. Yeah, are there any differences in how elder abuse presents?
So, Kate, did you want to have first go at that, or you want me?
I think that's a really interesting question, actually, because I think I mean, I'd like to hear from the audience whether or not they feel that whether or not there's some cultural component to, you know, is this abuse? You know, is there a cultural kind of, you know, bias that says, well, that's not abuse or that is? But from our perspective, you know, if you go back to that definition, where it's that breach of trust and that power dynamic, and if somebody is actually in distress or is fearful or you know, particularly, you know, in a situation where things are not, that person does not have a lot of power or, you know, say over how they live their life, for example, then in whatever culture you're in, that actually is abusive. So, but, you know, often older people might not, you know, see it as, you know, from their own cultural experiences, that might have been their normal. So, you know, I think it is around, you know, I spend quite a lot of time just actually sitting with someone and kind of identifying what's going on for that someone, and sometimes just shining a light on, you know, is that, do you think that's, yeah, is that okay? That kind of, you know, do you know that maybe what you're describing we might see as actually, you know, pretty abusive. And sometimes, you know, as Jeff said, it's a bit like, you know, what we knew about domestic and family violence 20 years ago. Often it's really around older women especially, but older people are not really identifying that it is abuse. And a lot of that is education. So I think a lot of what we're doing is actually, you know, just letting someone sit with that for a while. And like, you know, domestic and family violence, it can take a long time for that person to maybe take steps or to feel that actually they're, you know, in a position to do something about it. So it's complex, it takes time, and yeah, it's not an easy one.
Yeah, look, if I put my 20 cents worth in, my answer would be absolutely yes. I had the fortune in 2019 to receive a Churchill Fellowship to look at elder abuse responses across the world. And it was surprising how different countries and different cultures within that, not that I went to that many, were different in their response. And I think for me, one of the issues is the threshold. And I think Kate was sort of touching on that, you know, where it's beyond what's culturally normal. You know, I think sharing of resources between families is different in different cultures. For some cultures, we share everything, and so that's fine. In others, we don't. But there's a difference between sharing and taking as well. So Kate's suggestion of talking to the older person and helping them unpack what's going on, I think is agreed, very important.
Right. I'm just mindful of the time, so I'll try to get through as many questions as we can. What is the easiest way for an older person to access advocacy information? So making comment here that, you know, there's quite a lot of information on the internet and it can be quite confusing. Where is the best place for someone to get information?
I'd probably say 1-800-700-600, because that's a friendly medium for most people. Give us a call, have a chat. You know, our advocates are happy to respond. If someone's tech savvy, absolutely go to the website. But we know for a lot of older people, you know, that's quite difficult. So starting point is have a conversation, make a phone call.
Anything to add, Kate?
And I think also, if professionals think that older person might need a bit more support to access our services, then, you know, seeking some of those, like we've got a social work service, different organisations in OPAN might have a slightly different model, but we often provide, you know, social work service can provide a supported pathway where somebody can actually, you know, get linked into an interpreter and get supported with whatever help that they might need. So kind of a kind of open up the door and, you know, and support them through that process. So, and I'd say, I mean, Jeff, I'd say you have a similar sort of setup. But
Yeah.
Well, thank you. Next question is, how can we set up conversations about elder abuse with older people? So what are some of the things we need to think about when approaching it, I suppose?
Good question, Kate. Do you want to have...
Start with that one, Jeff. It's a biggie.
Look, I think it's like any issue. It's about, you know, it's about talking to people. It's about, you know, taking it a step at a time. You know, I think Kate touched on earlier the fact that, you know, you can start in your conversations of just raising a concern to say, you know, that doesn't sound right. You know, we do know that the current generation of older people are often called the grateful generation. They don't complain, they suck it up, they just deal with it themselves, and they don't think it's okay to raise those concerns. And I think it's about saying to people, it's actually okay to raise concerns, to talk to someone if what's happening to you doesn't feel right. And we do know, as Kate raised, that for many older people, they can blame themselves because if the perpetrator is their son or daughter, it may have been something that they've done wrong. They haven't brought them up the right way, which is, at the end of the day, is rubbish. You know, we're dealing with adults who are doing bad behaviour. So, you know, again, it's taking it a step at a time with people. It's about unpacking. It's, you know, also about talking about, you know, I've seen this before, and I know it's really hard for you to discuss, but I think it's really important. Yeah. My 30-second interpretation of how to respond.
I would completely agree with that too. That it is, and we just have to have more of these conversations so that it becomes more, you know, it's out there more, because it, you know, it needs to be a conversation that people feel able to have and comfortable having, and yeah, work in progress.
Absolutely. All right, we're on time, but I'm just going to ask one last question. Is advocacy different between home services and aged care facilities? So if you're advocating that there's issues in obviously the home setting or aged care facilities, is there a different approach to how you do that?
Look, I'd probably say no. I think the difference is that people in home care find it harder to find out about advocacy services being available. And again, that's where, you know, people like yourselves play an important role to say, did you know that there is help available and support available? Within the aged care environment, the residential care environment, we often will do education and information sessions. And a lot of times when we do that, talking about people's rights, someone will come up to us afterwards and say, oh, can I talk to you about, you know, this or that? For people who are at home, yeah, less connected, but it's the same deal. It's about supporting people to raise that issue with their service provider and to follow that through. Or if it's a serious concern or complaint, it might be supporting the person to raise that with the Aged Care Quality and Safety Commission, you know, which is you know, the government response. Or indeed, at the end of the day, if it's a police matter, then it may be supporting people to raise it there as well. But,
Thanks.
And I think it's important for some of the people that maybe you're all working with to know that I think often people think, oh, you know, linking into services like OPAN, for example, you know, I'm not going into aged care. I don't need any information about aged care. But in fact, you know, as Jeff said, aged care actually is, you know, it's a sort of a broad term, but it actually includes home care or care in the home, which can actually often be a protective factor for people to stay out of aged care. So getting information about, you know, planning ahead and getting information about what's going to keep you at home for as long as you want and need it's about getting informed so that you have choices to, you know, you might say, oh, that's never going to happen to me. My family will look after me. But it's it's knowing what your options are and knowing that the government services are there as a safety net and support, and it can keep you out of aged care. And it could just be about having someone to have a cup of tea with. Because, you know, a lot loneliness, I tell you, don't get me started. That's an epidemic too. But yeah. So anyway.
Thank you. Yeah.
If I can just throw in a last comment, there's ABC's got a series coming up, Older People's Homes for 4-year-olds, which is specific. It's season 2, and it's looking at older people who are living at home. And, you know, I think we'll give, you know, those online an opportunity just to look at a different approach, and OPAN's partnering with that. So we're hoping that it will raise the awareness of advocacy support more broadly. So 6th of April, 8:30 p.m, ABC TV. Thank you.
We'll have to tune in for that.
Yeah, good ad.
And thanks so much, Kate. Thank you both so much for sharing your insights today and providing us with such invaluable information on how we can support vulnerable older adults, advocate on their behalf, and how to recognise the signs of abuse. It's been also wonderful just to hear of the work of OPAN and how much you've actually are doing as a network, and how I guess settlement providers can access those services across the nation. So thank you so much for all the work that you do and for taking the time today to share that with us. Thank you everyone for attending. Stay safe and we'll see you next time. Thanks everyone. Take care.
Thank you so much.
Bye.